Hello everyone. So today we will learn about difference between the nephrotic syndrome and nephritic syndrome. So first, what is the function of kidney? So function of kidney is to excrete the waste product of the body. Okay, it is composed of four things. Now which is these four things? First is glomeruli, second is tubules, third is interstitium and fourth is blood vessel. Now whenever there is injury to glomeruli, then clinical manifestation of that glomerular injury is nephrotic syndrome and nephritic syndrome. Now what is the difference between the two? The first is nephrotic syndrome. In nephrotic syndrome, main symptom is there is massive proteinuria. Massive proteinuria matlab more than 3.5 gram per 24 hour protein will excreted in urine. Okay, so देखो most of the protein excreted in urine is albumin, so there is hypoalbuminemia. Now whenever there is less protein in the body, matlab there is less oncotic pressure, and less oncotic pressure matlab there is water into the interstitial fluid, so it leads to edema. Okay, so first is massive proteinuria, second is edema which occurs due to less oncotic pressure due to less protein. Okay, now third is hypoalbuminemia. Now to compensate the protein loss, liver will try to synthesize lipoprotein, so there is more lipid and there is more lipid excretion into the urine, so there is hyperlipidemia and lipiduria. Okay, so now what are the 5 symptoms of nephrotic syndrome? First is massive proteinuria, उसकी वजह से there is hypoalbuminemia, उसकी वजह से there is edema, and due to hypoalbuminemia body will try to synthesize more lipid and there is excretion of more lipid, so hyperlipidemia and lipiduria. Okay, now this 5 symptom is of nephrotic syndrome. Now nephritic syndrome. In nephritic syndrome, due to there is glomerular injury, there is excretion of red blood cells into the urine, so hematuria is present in the nephritic syndrome. Okay, now there is edema too, but it occurs due to sodium and water retention. Now third is hypertension, fourth is oliguria. Oliguria matlab less than 500 ml per 24 hour urine is excreted. Okay, now there is azotemia. Azotemia matlab there is increased blood urea nitrogen and creatinine. Okay, and sixth is there is mild proteinuria. In nephrotic syndrome there is massive proteinuria, and in nephritic syndrome there is mild proteinuria. Okay, so in nephritic syndrome we have to remember 6 symptoms. Okay, now examples of nephrotic syndrome and nephritic syndrome are given below. Thank you.